Been a rapid rise in information technology as well as digital health information. Despite those changes, there are many challenges to realizing the benefits from health IT and health information. We have not seen a concurrent transformation in healthcare, its delivery, the health of the population. I think we have a long way to go before we actually know how to realize the benefits from health IT. But one of the interesting opportunities is the simultaneous rise in machine learning or data science. There has been tremendous work sort of drawing on fields from computer science, statistics, and engineering that hopefully, or at least have the potential to give us the tools we need to better utilize digital health information and hopefully actually make true on some of the promises from health IT. We're joined by 3 experts from a wide range of fields who are going to share their experiences and backgrounds on big data and healthcare. This is going to be a relatively informal session. Each of them are going to talk for a few minutes, and maybe more than a few, but then we'll open it up for conversations with the audience, and we'd like you guys to be participating in this as well. So we have, and I'm going to botch the names at some point, but Dr. Joseph Toning from the FDA, medical officer and leader of data mining and text mining initiatives within the FDA. Mark Parody, from the Vice President of Optum Labs and Director of their Data Science University. And Spencer Jones, Chief Data Scientist at Tenet, who's often been a contributor and participant at White as well. Dr. Toning's going to start, and
Thank you very much. Can everyone hear me okay? Yeah. Good. Okay, I just have a few slides to get the discussion going. First of all, who wants to be brave and venture a guess as to what this slide is attempting to convey? Any takers? Any epidemiologists? Yes, who said cholera outbreak? Yes, the 1854 cholera outbreak in London. And I wanted to start with this slide. Of course, it's a very classic story, John Snow in London, the Broad Street pump, removing the handle. I wanted to start the discussion because that is a very classic story in epidemiology. And at that time, John Snow had the time to investigate this situation. There was a numerator of deaths. There was a denominator. There was a circumscribed area. And so, not that it was a very simple thing, it actually was a very revolutionary and groundbreaking investigation, but the point is the data was all there. And flash forwarding to the 21st century, FDA has a FAERS database. How many of you have heard of or are familiar with the FAERS database? Okay, so a couple of people. The FAERS database, it's the FDA Adverse Event Reporting System. It was created in 1969, and from when I came to the FDA, and actually there's an error on that slide because it should be from 1969 to 2003, 35 years. It took 35 years to accumulate 2.5 million reports. So again, over 35 years, from 69 to 2003. It took that length of time to accumulate 2.5 million reports. Now we are getting 1 million reports annually. So it's a tremendous growth with the internet and public information. There's a tremendous growth in that database. And just the obligatory FDA website slide to show the growth of FAERS. And the database contains reports submitted by the general public, pharmacists, physicians, patients, attorneys, pharmacologists, researchers, anyone around the world can submit a MedWatch report. That's the form. As you can see, there are a lot of different fields. And so we have the velocity of reports coming in, the variety of reports, all this different information contained in different fields. We data mine on product name and adverse reaction or adverse event. But quite a bit of velocity, variety in these reports. And of course, the volume is tremendous, over 1 million reports a year. We get about 3,000 new reports each day, and it is rather complex, even just if we focus on drug name and adverse reaction, because there's about 4,000 drug names and over 10,000 adverse events, MedDRA preferred terms for those of you who are familiar with MedDRA. And so if you just do simple math, 4,000 times 10,000, over 40 million drug event combinations are possible, as an example, penicillin and rash. So it's really quite complex to figure out what types of signals are happening in this database, what types of signals are occurring in this database. It is a post-marketing database of adverse event reports, as I mentioned, from the public. And the data is messy, there's a lot of missing data, and we don't have the complete information, but of course this information is very, very important for the FDA to make determinations once a drug is approved and there are new safety findings. How do we ascertain these new signals? Is it a real signal? Was it publicity? Was it a class action lawsuit? There are lots of ways that the data can be skewed, and so we really have to figure out exactly what's going on with the data. And the way we do that is actually, I don't want to oversimplify it, but in a nutshell, it's really similar to a relative risk. If we have a particular adverse event Y for a particular drug X, if you just do the relative risk calculation, observed over expected or exposed over not exposed, then you can have a very basic calculation analogous to a relative risk, A over A plus B over C plus D. So in other words, if you had, let's say, penicillin rash being A, and then over all the adverse reactions for penicillin, and then divide that by the same adverse event, i.e. rash, for all other for all other drugs, divided by all other adverse events for all other drugs. So it's not a relative risk per se because it's spontaneous data. It's not like a controlled clinical trial, randomized clinical trial. But with this era of big data, it really, our hands are forced to come up with ways, creative ways, and that's really part of why I'm bringing this to your attention, because I want you to think about what are some ways, given this era of big data, we can't always do the John Snow analyses. The data are coming in too quickly, it's very complex, and oftentimes we don't have the time to spend with very, very detailed studies that can take years to accomplish. So with our data mining system, we can do this in real time and figure out what's going on in the data in real time. So based on this whole concept of disproportionality. So not that one size fits all, but again, it's as you're analyzing your own data, think of what your control group is. What is your comparison group? And it's not always easy. It's not always clear cut. But again, it's always compared to what? What are you comparing your signal to? And so my last slide is, if you use the concept of map making, and of course I showed the John Snow map early on, these are two maps of the same part of the world. And in 1040, a very early map of the Mediterranean, you know, it's really difficult to see exactly what's there, but if I have a pointer that will, yeah. You could sort of see England here, you could sort of see the Mediterranean here, you can sort of see Spain and Portugal here, and then the rest of Europe here, and North Africa here. So of course it's not perfect, and the better our systems are, the better our data are, then we can hopefully, and the better our algorithms are and the defensibility of our algorithms, then hopefully we can get something like this, which again is not perfect, because if you look at a map from 2016, you're going to see some differences here. But at least we can go from something like this, and this actually isn't bad. I mean, this was more than they knew 500 years before this. Eventually, we can go to something like this. So that concludes my discussion.
So let's see if we can, where do we have? let me say, first of all, how excited I am to be here and to be in this group of people. I think it's a fascinating topic and a lot of good conversations. And I'm very pleased with what Dr. Simpson and Dr. Tunning have said, because I was a little bit afraid at first that I would be, that some of my message might be preaching to the bar, but I think I'm preaching to the choir in this case, which is a friendly audience. So first of all, I just want to introduce you a little bit to Optum. You probably all know who Optum is, right? I'm part of Optum Labs, right, which is a division of Optum. Optum obviously rolls up to United Health Group, United Healthcare. Right, we are a Fortune 6 company, global, sort of a multinational company, right, responsible for in many different aspects of the healthcare space, and have access to quite a significant sort of data set out there. My particular role is as Vice President of Data Science University, and so a lot of what I'm going to be talking about is going to be sort of very much colored by the fact of what I do and what my role is. So I guess, first of all, one of the things I should also say is that what you're going to see here is not necessarily the sort of approved Optum United Health Group, United Healthcare view of the world. A lot of what we're doing and a lot of what I'm doing is still very much work in process. So this is sort of my view on these things and how we're trying to make these things happen within this organization, within this 240,000 person organization that is United Health Group, and how we're trying to really sort of bend the curve. So first of all, I want to sort of orient everybody a little bit to what we really sort of see as the elevator pitch for Data Science University. So what we really see is about developing this healthcare-specific data science, machine learning, big data competency that we're going to disseminate throughout the United Health Group family of companies, partners, and clients. And that's important. It's not just something that we want to do within the United ecosystem, but it's also something we really want to push out as well to those folks that we work with and those constituencies we serve. We want to do this by empowering individuals with knowledge and skills, and importantly, judgment. I think that's a piece that's often missing in order to really drive towards these business value or healthcare value in what are agile timeframes. And I think this is something we'd also talked a little bit about as well, right? It's very important that these not be years-long efforts, right? We have to be able to do this in rapid cycles and rapid iterations. And interestingly, it's one thing to be agile when you're a team of 20. It's totally different to be agile when you're a company of 240,000, right? And so that's a lot of what we're trying to figure out and work through as well. Why are we doing this? Well, we want to do it really to accelerate this notion of consistently excellent, high-quality, data-driven innovations, right? So a lot of these themes that we've already heard. And really, again, this notion of improving health and healthcare for all. And then finally, sort of what is our secret sauce, if you will? Well, so within Optum Labs, we're going to be doing this based on sort of the deep relationships that we have already developed and that we'll continue to develop within that United Health Group family, and really based out of our demonstrated capabilities, right, in education, collaboration, and delivery. So that, I think, orients a little bit. Now, I think it's worth talking a little bit about, again, like I said, my talk's not going to be so much about sort of what we are doing at Optum Labs or the data science that we're doing at United Healthcare, because I couldn't possibly express to you, right, the depth and breadth of what we're doing there. But it's really, I want to say, when I think of data analytics, I think of people. I think of the people who are going to be doing the data analytics. And I think of, all of this sort of noise. We've heard, this data scientist shortage. We don't have enough people. We don't have people with the training sets or with the training, with the appropriate numeracy. And I kind of remember, too, back when I started in this field, sort of around about 2000, when I made my transition out of academia into industry, and I would get up in front of people and say, well, so what was the median, right? And everybody's eyes would kind of cross, and I'd say, well, mean. And still, people were kind of looking at me with a little bit of confusion. I'd say, average, right? And the response we usually get is, oh, that's a function in Excel, right? So we've come a long way, I think, since 2000 when I made that switch. But we've got these expectations of these unicorns, right? And I tried to go for a sort of a gender-neutral unicorn here, right? We've got this expectation of the full-stack developer, right? Someone's just going to sit down and they're going to know Python and they're going to know R and they're going to know Spark, and they're going to be able to code as easily in Java as they are in C, and they're just going to kind of crank through this. I couldn't find a gender-neutral programmer. And then once we do this, dollars are going to fall from heaven, right? Money's going to be there, and lo and behold, before you know it, and here's my Skynet reference, right? We're all going to be taken over by the machines, right? AI, cognitive computing. We're all going to be out of jobs. What's this going to mean? What's it going to look like for the future? Well, maybe this is all coming, but I really kind of want to start from a little bit of a different place, right? And with a little bit of homage to Leo Breiman and his sort of seminal paper there from about 2000, I think it was, right? You know, statistics, sort of the two worlds of statistics. You know, I really think historically we've had these two worlds, you know, academia and industry, and they've had very different goals, very different pursuits that they're after, and different philosophical approaches, right? And I started off in academia before I made this switch, right? And so when you sort of think of what it is that academia used to care about, right, or should care about, right, to some extent is this notion of perfection and truth, right? The reason it takes 4 to 5 years, right, for anything to get done in academia is because you want to make sure that what you say is true. Because you're standing up in front of a room like this, you're presenting your data, and half the people in the room disagree with you on the interpretation of that data, and you better be willing and ready to defend it, right? Sort of the lone man or lone woman against the world, right? And you compare or contrast that with industry, right? Which is just good enough, right? And deliver value, right? And these are two very sort of different goals. Now, I think there's a lot of fascinating and wonderful things about academia, right? In many respects, I wish I could go back to being an academic, and maybe I have right now that I'm part of this data science university thing. But you get to stay engaged with new concepts. You get to stay engaged with debates. You work with really intelligent people. Not that you don't work with intelligent people on the industry side, right? But you are at the cutting edge of technology, right, and thought, and that's fantastic. There's a lot of energy and enthusiasm and drive. You get to work with young people, which is also fantastic. There's a lot of great things about industry too, right? Industry gives you real units that you can measure your work against, right? It gives you urgency, right? You get to feel that you're making an impact, right? When you actually get to the stage where something you've discovered or worked on is implemented and it's impacting people's lives, you know, it's not just that the other 5 people in the world who understand the math in your paper, right, who are impacted by what you have to say. So this is a real concern, and this is kind of the world that we've been living in. And part of what we're trying to do then from this with Data Science University is try to take a real look at what reality is for us, right? And reality starts with some kind of a customer need or a customer pain or a customer opportunity, right? And somehow we have to get over to business value, right? And I want to be careful here to make sure that it's a notion of value that we're looking at, right? Because not everything is measured in terms of dollars. Certainly, you know, dollars are the units that we use to move and to move the world, but it's not everything is measurable in that way. For instance, I'm sure we're all very aware of the sort of horrible opioid crisis that we're having in this country with respect to addiction. And there's no real dollars that you can measure there, but we're doing lots and lots of work in that space to try and identify folks who might be at risk for opioid dependency, to try and figure out ways to intervene in that. And I think we can all sort of hope or assume or see that there might be some dollars in there, but it's really not a dollar-driven exercise, right? Whereas, you know, sometimes you get to much drier things about, you know, how do we predict when servers are going to go down, right? Can we build machine learning models on that, and those tie directly to dollars? But somehow we have to get from that customer need to the business value, and we have to navigate through these sort of 4 worlds, right? Business, IT, leadership, and the customer, right? These are non-trivial worlds. These are people who speak different languages with different priorities, different sets of concerns, different sets of expertise, and you really can't get from that customer need to the business value, right? Important to mention too, you've got competition, right? That competition can either be internal competition, sometimes from other teams. It can be external competition from other companies. Anything from sort of the proverbial startup in a garage, right, all the way up to you know, your sort of largest corporate competitors. And so how do you really get from that customer need to that business value in this agile time frame? And by agile time frame, I mean, you know, weeks or months. Which isn't to say that there aren't large multi-year efforts, that some things aren't huge, but every huge project, every journey, right, can begin with a single step and can be broken down into individual steps and waypoints along the way. And so really how we're trying to conceive of data science is as this intersection, right, where I sort of put it up there on the slide, right? It's really this, how do we develop people with this skill set, right? Because when I think about, when I think about United Health Group, right, you know, and I think about sort of the real hardcore, you know, data science, computational folks with PhDs and 10, 15, 20 years of experience, you know, we maybe only need 2, 3, 4,000 people like that in the company, right? Because beyond that, we're not really utilizing them effectively, right? It's the same thing. There's only a certain number of physicians you need, right? Your physician probably shouldn't be taking your blood pressure, right? And that's kind of the way we run medicine now. We recognize that physicians are there for higher value add functions than some of these more sort of very important, but not so interpretive or not necessarily capable. And so from that standpoint, within Data Science University, we're looking to take folks and really being able to build them, give them this skill set, not just the sort of the hardcore, how do you do, GLM theory and boosted trees and support vector machines and kind of getting them into the math and the theory behind that, but also really teaching them the soft skills that go along with it. How do you assemble these teams, right? How do you gain the trust and respect of the optimization engineer, right? In the back office, while at the same time assuring or reassuring the business subject matter expert that you're not going to be putting them out of business with some form of automation, while finding a way to take what is fundamentally something that you could write a 20 or a 30-page detailed paper about, right? And take that up to a boardroom level where you've got literally 2 sentences, right, to get the message and the value across to someone who has, hasn't looked at a linear regression since high school, right? And so, and ultimately, again, you can do all of this work, and if at the end of the day it's not something that appeals to the customer or sings to the customer or meets their need or delights the customer, it's sort of a tree falling in the forest. So it's really important to have all of these parts and pieces working together. And this is a lot of what we are trying to do with Data Science University. And we feel that an organization as large as ours probably has an almost insatiable need for folks like this. And I think the industry in general does as well. So, ideally, I'd like to get to a place where it's the best of both worlds, right? Where we take the best of what's in academia, the best of what's in industry, right? And we create this middle space, right? And where we can do things like we can look at, and one of the things that really excited me, because I was never a particularly good bench scientist, but what I loved doing was sitting down with a data set, at 8 in the morning, and I would look up at midnight, not having eaten, right? Just playing around with that data, parameterizing that data, trying to understand it, trying to understand, what are the drivers, what are the mechanisms, what are the rules that sat underneath that data and created that data set. But that's done with a lot of rigor, and it's done with a lot of attention to detail, and it matters how the data was collected, and it matters how you draw the box, right? And it matters what questions you asked and what questions you're trying to ask, right? So to be able to go and take these business data sets and treat them with the same kind of rigor that you treat an academic data set with, I think is really key. Being able to again, take that urgency and that excitement of, I am finding new things, right? I am discovering the drivers, the mechanisms by which this data was collected or created. And importantly, that on the basis of that, I can now go and take that directly into something that will affect people's lives, right? And affect them in a very, very real, very meaningful way. And I can do that again in these urgent time frames, and I can be held accountable, right? I mean, that was another thing I had a lot of trouble with when I was in graduate school was, I guess I was held accountable, but so long as my NSF grant was there, right, no one really cared, right? I wasn't held accountable. Wasn't held accountable until the NSF grant was about to run out, and then my advisor said, hey, maybe we should talk. In industry, there's this great notion of being held accountable, right? You have to justify your salary every day. And I think that provides a lot of urgency. You get a lot of competition in this world as well. That's really what I'm hoping to create and what we're looking to create inside Optum Labs, and to really roll this up and find ways to bend the curve and to move United Health Group, and by moving United Health Group, really move healthcare in the U.S. and eventually internationally as well. Thank you.
I think Spencer's going to take a moment to set up.
In the healthcare ecosystem. And it's fascinating to hear that you've sort of moved away from the traditional model of research to state-of-the-art techniques using data mining, machine learning, et cetera. There's always this tension between what's the quality of evidence that's being produced by the results And I'm curious to hear from a policy perspective, what do you see as some of the challenges at infusing these state-of-the-art techniques into regulatory decision-making?
Yeah, thank you for that question. It was really a paradigm shift, and as I mentioned, we really had no choice. We had no option because the data were just coming in so quickly, in such a complex fashion. But we engaged stakeholders early on, and the primary stakeholders were the pharmaceutical companies, and they were also very interested in data mining. This disproportionate, there are, of course, many different data mining algorithms, but when I mention data mining of drug safety databases, I'm really talking about that whole concept of disproportionality, that concept of a relative risk type of calculation. And others were interested, other stakeholders were interested because they had their own databases. That the FDA FAIRS is publicly available on the internet, but they also had their own databases, and they were faced with similar challenges. So we engaged them early on and had discussions with them about what conclusions can we draw from this kind of analysis, given the fact that it is spontaneous data and that there can be many reasons for a spike in the data and determining what's a signal, what's the definition of a signal. And so I think really when embarking on some kind of a new algorithm, and I think really where it's relevant for all of you is even just at a hospital or clinic level or organizational level, when you are embarking on something new, really engaging the stakeholders and making sure every step along the way, am I thinking about this correctly? Correct me where I'm wrong, and let's have a discussion about this because yeah, things are complex, and we really have to, as I mentioned before, being creative and also curious to figure out how we can analyze the very complex data that are coming in the same way that John Snow had to figure this out, and this had never been done before, and so he had to figure that out. So yeah, but I would answer your question, engaging stakeholders very early on and having that checks and balances.
Hi, good morning. Steve Davis from M3 Information. So when I heard you ask this question, what I reinterpreted in my head was the issue of garbage in, garbage out problem. And I'm thinking about the AMIA meeting next month where they're spending a whole day on the ability to do good natural language processing and pulling out information out of psychiatric, I'm a psychiatrist, out of psychiatric text. Dictations and so forth. And I'm also now thinking about me as a physician using these EHRs, which with a lot of check boxes and so forth. And we know about the quality of the notes have gone down since we moved from, kind of dictated and descriptive language into these kind of check boxes. So I'm concerned that as we move in that direction, as we have done, that these the data mining, how do you attach levels of confidence to this data and screen out stuff that is crappy?
Yeah, good question. I think really knowing the nuances of your data and really someone or a group of people who are really intimately involved with the design of the new system for data collection, knowing the limitations, knowing the caveats, the same with our FDA FAIRS. A lot of the data actually is quite good. The drug names are cleaned before entered into the database, and all of the adverse events or side effects that are contained in the narrative submitted by the public are mapped to MedRA preferred terms. So there's standardization both with drug names and the adverse event, the side effect. But yeah, really knowing when a signal is generated or when something interesting appears in the data, then having the group of experts, stakeholders, and saying, okay, this is what we saw, but is this real? And having that openness of being able to challenge, no, I don't think it's real, or somebody saying, yes, I do think it's real, and really engaging people. But yeah, a key thing obviously is knowing the nuances and limitations and strengths of the data collection.
Thanks, this is a great answer. So if we consider the agility in, I think, one of the slides, so how can this attention to detail and time spent on data analysis can go hand in hand with the business pressures and the need for agility as we move to this new big data era?
This is directed. This is open to. Okay.
Sure. So I guess since that was my slide that had agility on it, I'll start. It's definitely an art and a balance, right? There's no hard answer to that one, and I think there are. Look, so if you go back to the origin of agile methodology, right, with respect to software, right, it was very specifically directed at some problems that were going on with waterfall, sort of big methodologies, right, and very sort of exciting as a different approach. But if you look at the criticisms of any agile approach, right, one of the common criticisms is you lack architecture, there's no long-term vision, you're just solving sort of an immediate problem, you're lurching from one week-long sprint to the next without any real goal or direction. And I think the thing to remember is that you can still have multi-year projects, you can still have high quality, right? But you have to chunk and break up the problem, right? Rather than looking at it as a giant a deliverable with a series of sort of discrete serial phases in it, you have to start looking at it as breaking each of those pieces apart. And now you have to say, well, data quality is one of our sprints, right? Understanding the data is one of those small pieces. And so can we get to, within a week or a month, can we get to that gating mechanism, that go, no go, that success or failure stage that says, do we know the data well enough to go on to the next stage? So there should always still be elements of architectural thinking. There should always still be elements of long-term thinking. You shouldn't be sacrificing quality. And ideally, this is another thing that's very important for us, is when you're defining a project, it's not just about the intake aspects or what you need to get the project started. It's also about how you're going to measure the project at the end. We don't want to start a project that we can't tie to direct gating measures and ultimately to value in some way as well. And so from that standpoint, you can tie those interim, data quality, ETL, all that type of stuff that occurs. You can tie those still to measures of value and things that are meaningful, and move the business forward without having to sort of wait until to make your judgment to the very end, right?
All right, thank you.
Well, thanks again to all our panelists. Very nice insights. So at this time, let's take about a 10-minute break, and then we'll move to our next keynote speaker, Anil Jain from IBM Watson, who we'll be really excited to hear from.